Hello, welcome to our first detailed disease report video. This is Jaden Ong of CareCraft's Project Fremont, and today we are going to discuss a cognitive disease that has been on the rise in the United States. Deaths around this neurological disease increased by 140% in the US in 2021 and is currently the seventh leading cause of death in our country. It affects around 7 million Americans today, and more than $340 billion have been spent towards caregiving and research around it. So what are we covering today? Today, we are covering Alzheimer's disease. Fortunately, Alzheimer's is a very recognizable disease, as it causes a person to slowly lose parts of their memory. This allows the signs to be prominent, as many people close to the patient will begin to notice these sudden voids in the person's memories.
Aside from close friends and family, other people close to the patient may recognize this disease as well.
In its final stages, AD can make even the most basic tasks nearly impossible. People can forget times, dates, events, and places, even if those places are part of the person's everyday life. This dysfunctionality is caused not only by the deterioration of a person's memory, but also due to impaired thinking and reasoning, especially noticeable with abstract numbers.
AD is also more prevalent in those with old age, as 70% of all AD cases are in those above 75 years old.
People with Alzheimer's may also have trouble with carrying out routines in their everyday life and may need specific care all hours of the day. In severe cases, Alzheimer's can cause one to forget even the closest family member faces or identity, as the person begins to become unrecognizable to them. Alzheimer's disease has clear symptoms but an unclear cause, as people develop it for various reasons that can be based on genetics, the environment, and style of living.
Early onset familial Alzheimer's disease, or EPAC for short, is the irreversible genetic variant of AD that makes up about 5% of all cases. It occurs as a result of mutations in the presenilin-1, presenilin-2, or amyloid precursor protein genes, with presenilin-1 mutations being the most common. Although rare, once a family member experiences this mutation, it has a 2% chance of being passed down. These genes digest amyloid beta peptide. Once mutated, they lose their functionality and are no longer able to digest it. This leads to the formation of pathogenic aggregates that deposit as amyloid plaques. These plaques weaken the immune system. This leads to weakened neuronal communication, impaired cell function, inflammation, cell death, and eventually cognitive decline.
Alongside genetic conditions, environmental factors can also increase the risk of Alzheimer's. These include air pollution, head injuries, exposure to toxins, and vitamin D deficiency. Additionally, poor lifestyle choices such as unmanaged health conditions, poor diet, smoking, excessive alcohol consumption, physical inactivity, social isolation, sleep deprivation, and lack of mental stimulation may all contribute to the development of Alzheimer's. While there is currently no known cure for Alzheimer's disease, there are treatments available that manage its symptoms and slow its progression.
Medications like cholinesterase inhibitors, donepezil, rivastigmine, and galantamine improve memory and cognitive symptoms by boosting communication between nerve cells. Memantine, another medication, protects against neurotoxicity by regulating glutamate activity, reducing memory impairment, and cognitive decline. These medications are often combined for greater effectiveness.
Additionally, FDA-approved drugs like lecanemab slow the disease by preventing amyloid plaque buildup. Administered through IV, this treatment carries risks like brain swelling and bleeding.
Beyond medications, lifestyle changes can have a significant difference. Establishing routines, simplifying tasks, regular exercise, and a healthy diet can improve quality of life for Alzheimer's patients.
Alzheimer's disease remains one of the most profound challenges for individuals and their families. Early diagnosis and intervention are crucial to minimizing its devastating effects on memory, cognition, and daily life. Thankfully, organizations such as the Alzheimer's Association and the Alzheimer's Foundation of America help fund research, raise public awareness, and provide vital resources for patients and caregivers. By supporting these nonprofits and prioritizing these efforts, society can move closer to alleviating the burden of Alzheimer's and improve the lives of those it affects. Thank you for watching and stay tuned for our monthly video reports.